Namaste. Welcome to the episode of Tulip Mediworld Health Talks. Today, we are talking about something that affects millions: chronic back pain. It's not just uncomfortable, it can impact mobility, work, and quality of life. Today, we have Dr. Arindom Kakati, Director of Neurosciences at Tulip Mediworld, to break it down that how we can manage back pain. Dr. Arindam, welcome to our show.
Thank you. Thank you, Supriya, for having me.
Thank you, sir. So, Dr. Kakati, let's begin with some basic questions. Many of our audiences, they have sent some question about chronic back pain. So, what is this chronic back pain and when should we seek a medical advice?
That is a very important question. Chronic back pain means a back pain which has been there for more than 6 to 3 months, 6 weeks to 3 months. So once it becomes that long, it is considered as a chronic back pain.
Okay.
Now, as a rule, most of these back pains are not ominous. Usually these are some sprains or some joint problems, and they do not require much treatment except for some medicines and physiotherapy. However, if your back pain is going to your legs, you're developing numbness, you're developing some problem in passing urine,
Right.
or you're having the severity of your pain is increasing over time, and you're having night pain, then this can be dangerous back pain, which needs to be evaluated. So this is important to know.
Right. Because many of the times we see that we avoid, even if you have a back pain, we wait, we think that it will disappear over time. Okay. So now, doctor, is chronic back pain always due to something serious like slip disc or something? Is it always very serious to consider?
No, it's not always serious. As I told you to the answer to the previous question, 90% of back pain are not ominous, not serious.
Right.
10% needs further attention. And very rarely back pain can be due to infections like tuberculosis, which is common in a part of the country. It can be tumors, it can be slip disc. So as I told you, those things, the signs if you have, then it needs evaluation.
Right. So doctor, like in Tulip Mediworld, you have a neurosciences department. What kind of evaluation, what kind of test you suggest?
Yeah. For chronic back pain, first thing is the proper clinical evaluation.
Right.
Meaning, what is the exact problem? Is it due to some disease on the spine? And then focused investigations, like the best thing is to do an MRI. So depending on the findings of your clinical examination and your MRI findings, then we further decide what is the best course of treatment for this kind of patients.
Right. So I'm very curious, as a neurosurgeon, when do you typically see back pain patients? Like as a neurosurgeon, how often you encounter with this? And
see, as if you look at the data available in the world, 90% of the population in this world will have back pain in some point in their life.
True.
So as a neuro person, the commonest kind of patients come with back pain. The majority of them. Of course, we do see headaches, we do see tumors and all, but as a rule, the commonest patient that turn up in the OPD is back pain.
Back pain. So what are the red flags in back pain that should never be ignored?
That's what. The main red flags which never should be ignored are shooting pain into the legs with numbness. If you're developing some weakness in a particular part of your limbs, you're having difficulty in passing urine, or you cannot control urine. You have numbness in your perineal area. These are red flags. So if those things are there, weakness, urine problems, then it needs urgent evaluation. The meaning of it being a red flag is that these signs mean that your nerves are already getting damaged. If you do not do something urgently, then you might never recover those functions.
Okay. So this is that alarming.
Yes.
Right. Okay. So doctor, now we would like to talk about some myths and facts. Is back pain always caused by slip disc?
No, but slip disc is one of the commonest causes of back pain.
Okay. And should you always get an MRI if you have a back pain?
No. First, you have to evaluate what is the cause of the back pain. if it is suggestive that there could be those ominous signs are there, or suggestive that there could be some serious problem, then only MRI needs to be done.
Right. And is surgery is the only solution for this?
Not at all. 90% of back pains can be treated with medicine and physiotherapy.
Oh, that's a wonderful news, because always we are scared that if I have back pain and somebody will ask for a surgery, we avoid as much as possible.
Let me add to that fact that surgery is not dangerous for back pain.
Right.
The risks related to back pain surgery are same as those for cholecystectomy, gallbladder surgery. Nowadays, we see the disc through microscopes, endoscopes, it becomes this big. So chances of nerve injury is very limited.
Right. So
if it is required, it can be done, and you need not worry that you'll end up in the bed for life.
Right. That's a choice, right? Like that's a good choice if I really need a surgery.
Because these are functional problems.
Right.
Because of that, you're not able to lead a normal life. So your life is getting affected for the rest of your life. It will get affected. So why not have a proper life if you have a option?
Right. Very true. So I'm very curious to understand, like, if I need a surgery, will it be always a major surgery? Like, how to consider how major is that surgery?
Okay. So like interventions for back pain. So depending on the kind of pathology you have, supposing let's talk about discs.
Okay.
So discs can cause pain due to a lot of things. Small discs can also press on the nerve and cause pain, or large discs are there. So depending on the type of disc, various types of treatments are available. Nowadays we have very small problem, we can give root blocks also. These are very minor procedures where you just inject a medicine into the root to make it numb. By the time the effect of the medicine goes off, the patient recovers from the problem, may not have pain further.
Right.
Bigger problems, nerve deficit, may require nowadays minimally invasive treatments available, what we call as MIS. So endoscopy is there, microscopic surgery is there. Of course, if you have a large disc, a large compression, then you will need a proper surgery.
Right.
But there are multiple options depending on which kind of problem is causing your symptoms.
Okay. So it's not scary anymore.
It's not scary at all.
Okay. Right, doctor. And within how many days of surgery a person can resume his normal life and all activities?
Usually we keep you in the hospital for 1 or 2 days post surgery. You can go back home after that. Walking is allowed. Going to bathroom is allowed. You can go in a vehicle also. It is allowed. Heavy activities as in lifting buckets, lifting bags and all, those we would advise you to do after a month or so. Rest of the things like joining back desk job, after 1 week you can do.
Okay. Can I play basketball, cricket, swimming?
Of course you can play. We have defense people who have joined back after getting this surgery done. So it can be done, no issue.
That's great, doctor. That's really, very great. So now, what lifestyle changes can prevent or help to reduce back pain?
Yes, that is an important question, because most of the back pain nowadays that we see are in the people who are in the sedentary group or in the athlete group, who are manual laborers. So also we are seeing people having back pain from who are going to gym. So it's mainly related to posture you keep and how good are your muscle tone. So the posture, if you have a slumping posture, you slouch down, or you do not lift weights as it should be done. So sudden jerky movements, those do lead to these kind of problems. Of course, there are some other problems. You may have congenital problems of your spine which can aggravate these kind of diseases.
Okay.
But yes, posture, the type of work you do, and you should have a little bit of physical activity so that your back muscles are toned. That is important.
Right. So as we see that many of the people, those who are doing desk job or they are standing for a long time, usually they complain a lot about back pain. So what would be your advice to them, in terms of suppose stress also? Do you think that stress also plays a role? Like many of
Yes, stress causes more of neck pain than back pain. That's my clinical evaluation have shown.
Okay, that's interesting.
And basically, as I said before, the tone of your back muscles is important. If you just keep in one position, slouching down, then you'll invariably end up, because all the structures in your back are getting strained without any support.
Right.
So you will have back pain. So if you have a full sitting job, maybe you should get up in between, stretch. In the evenings, you can do some back strengthening exercises. Those are not very rocket science exercises. Those are very
True.
simple exercises. You can get anywhere it is available. So you should take care of your back.
Activity.
That's all. Yeah.
Some kind of activity. And does physiotherapy plays a major role, or like do we consider physiotherapy in initial stage when we have a
Of
back
course,
pain?
physiotherapy plays one of the most important role. To prevent back pain, it is important. If you have back pain also, for treatment, it's important. Post surgery also, it is important for rehabilitation.
Right.
So in all these three phases, you need physiotherapy.
Right. Thank you so much, doctor. And lastly, what are the modern treatment options beyond just surgery? If you can just elaborate that part.
Modern as such, meaning the cause of the back pain, if you're talking about discs, or you're talking about all overall. So let me first break it down into few important causes of back pain. One is, of course, disc. For disc, as I told you before, depending on the type of disc, previously, of course, everything was operated, meaning by open surgery and all. So nowadays, the incisions are getting smaller and smaller. Reason being that you cut less muscle, causes less post-op pain, chances of less complications of the wound.
Right.
But the main job that is done inside, it is to decompress the nerve. It is the same almost in whatever, like endoscopy you do, microscopy you do. So this is there. Other things, as I told you, if it is not very severe, we can watch and wait. Patient needs treatment for pain. There are minimally invasive further pain treatments, like injections, root blocks are there. And this is the gamut of the disc treatment. Other causes of back pain, like in elderly people, the common cause of back pain is osteoporotic collapse.
Right.
Okay. So in those cases nowadays, because the bone has collapsed, there's pain. So because the bone is crumbled, movement causes pain. So we can fix those bones by injecting cement inside it.
Okay.
Without operating, like cutting and anything. With a syringe, we can inject cement. That procedure is known as vertebroplasty.
Okay.
So that is one. Fractures, traumatic fractures can cause pain. So in those cases, nowadays, we can do minimally invasive spine fixation, where you don't need to cut. We can make holes, put the screws and fix the spine. That is a possibility. Tumors and all, of course, you have to operate if they are there, because there's most spine tumors you cannot radiate inside spinal canal. So those you have to operate.
Right. So we have to find out what is the cause
Yes,
and
that is the
evaluate
most important thing.
Right. Okay.
And that is why you need a proper evaluation if you have those red signs.
So any symptoms should not be avoided, or
Yes.
wait for the last moment when it is like I can't move anymore.
Yeah.
I have to see a doctor. So we should not wait.
Correct.
Right. Thank you so much, doctor. And final thoughts. One thing, like what's one thing you wish every person knew about back pain?
Very nice question. The thing is that do not ignore your back. Whenever there is a sign, as we have previously discussed also, that you are having one of these red flag signs, like shooting pain in your legs, any weakness or numbness in your legs, you're having difficulty in passing urine, or you're leaking your urine, or you're leaking your stools, in those cases, please do not wait for further. Get it evaluated with a neurologist or a neurosurgeon with an MRI as soon as possible, because things can be changed if they are treated early.
Yes, doctor. And lastly, any closing message to our listeners dealing with back pain right now?
Same as I told you, that do not ignore the red flags.
Evaluate.
But do not be scared. Spine treatment is there. Problem treatment is there. And nowadays, the treatments are quite good and the results are quite good.
Thank you so much, doctor, for
Thank
being
you.
here with us today. And this is really very interesting. I'm sure many people, we are facing this back pain these days, especially the young group also. We see they are always complaining about back pain. Even school going students also, sometimes they say that we have a back pain, and which you said that posture correction will play a major role.
Correct.
So lifestyle modification, also will be a part of our journey.
Correct.
Thank you, Dr. Kakati, for clarifying with practical advices. For those watching or listening, chronic back pain is not something you have to live with. At Tulip Mediworld Hospital, our team is equipped to guide you with personalized care from diagnosis to advanced treatment. Stay informed, stay active, and stay pain free. Thank you for watching this show. Namaste.